Welcome to your ImmPrint tutorial series. In this video, users will learn the rules concerning certificates of immunization. Once the patient's record is pulled up, click Certificate of Immunization, as shown here. The expiration date is auto-calculated for all sites. Sites with licensed physicians can edit this date for not greater than 2 years beyond the auto-calculated ImmPrint date. Once this has been done, school nurses will now see the physician-provided expiration date. Then select whether or not you want the parent's name to appear on the certificate of immunization, then click Submit. The certificate of immunization is now visible. The patient's name appears directly below the ImmPrint logo. The patient's date of birth appears right below the title of the document. The COI expiration date appears in the top right-hand corner. If the user opted to have the parent's name to appear on the document, the parent's name appears below the patient's name. The state seal appears in the background in the area where the shots appear. In the bottom right-hand corner, the site information appears. Sites that have licensed physicians providing direct care to patients can edit the COI expiration date. All other users will only be able to print the certificate of immunization if the patient is up to date on all school-required vaccinations. It is also important to remember that only valid and school-required vaccines appear on the certificate of immunization. If you wish to review the Alabama school law, this can be done from our webpage at www.alabamapublichealth.gov/immunization. From here, click on Immunization Resources. From here, under School Resources, click Alabama School Immunization Law Rules. This is the Alabama school law. Under the section labeled Immunization Schedule, you can see all of the required shots and related information. From the patient list, multiple COIs can be printed at once by using the Print COI checkboxes in conjunction with the Print Certificate of Immunization button. Notice if the patients are not COI age, the checkboxes are gray and cannot be used. Check multiple patients, then click the Print COI button. Be advised, when using the Print Multiple COI functionality, only patients with up-to-date records can have COIs printed from the patient list. If a patient is not up to date, this message, along with a red indicator, will appear, identifying the not up to date patient. Click the X on the dialog box and then uncheck the applicable patient. Then click Print Certificate of Immunization. Your multiple COIs are now ready to be printed. Some patients may have a medical contraindication or medical reason why vaccination should not be administered. Only primary care providers may issue a medical exemption. To issue a medical exemption, click Medical Exemption. From this screen, enter all of the necessary information. In the first drop-down, choose whether or not the exemption is going to be a full or partial exemption. If the exemption is partial, then in the next drop-down, identify the correct antigen. Select the authorizer and click Add. At this point, a medical exemption is ready to be printed. Click Print. The medical exemption is now visible. Immunizations conflict with the religious beliefs or tenets of some patients. If that is the case, please send that patient to the county health department, as the county health department is the only entity that may issue a religious exemption. For county health department users, click Religious Exemption. From this page, enter all of the necessary information. As the patient is a minor, the requester's information is necessary. Using the drop-down menu, indicate the relationship to the patient. In this case, we will use the mother. Enter the requester's last name, the requester's first name, and if applicable, enter the requester's middle name. Then type the reason for the objection. In the next section, use the first drop-down menu to identify the religious exemption as full or partial. If the exemption is partial, use the next drop-down to identify which antigen the patient will not be receiving. Then use the check boxes to indicate that the requester has submitted a written objection, reviewed the video about the dangers of not vaccinating, and signed a do not vaccinate statement. Then click Add. This partial religious exemption has now been added. Click Update and view printable form. The religious exemption is now visible and can be printed. If you have any questions about certificates of immunization, medical exemptions, or religious exemptions, please contact your immunization compliance team member or manager.